there were parents who came from all over the state, but this couple, Charlie and her husband Will, they're farmers they're out of Ronan, the Codys, and they have a son, Decker. And they were almost like the counterpoint to Laura Simonson. They complemented her strengths with their own kinds of rural farm kinds of strengths. I mean, Laura is an urban mom. They are a farming, ranching family, and when you hear Will get up and talk about that they had to sell some of their livestock to pay for Decker's treatment. I mean, that's a pretty moving story. You're not seeing some slacker guy. It's just an old farm, a young farm guy who works with his dad on the farm, and managing a herd of cattle and talking about. But it's Charlie, the mom, who she was connected in that whole Flathead Lake Mission area all the way up to Whitefish, and just working with parents and school officials. She just did an amazing job of kind of corralling people, and so when I think of really the two kind of pinches in my mind of those that went above and beyond, I think certainly Laura and Charlie, so east and west, and that's not to minimize the tremendous behind-the-scenes efforts of people writing letters and emails and telephone trees and distribution lists, and the efforts that Pluck did, putting information on the website was tremendous. Just because Pluck provided, that a powerful opportunity to be able to reach people all over the state in ways that I think the parents didn't have that kind of resource. When I think of, we put on Easter Seals and MSUB and some others put together a conference that was last August, and we had a panel and we began to talk about these legislative issues and the challenges that parents of young children and parents of late adolescents and young adults, and the challenges from the parent standpoint of what they have to do. It really is remarkable. But I think of Kim, what is Kim's last name?
I don't remember. I don't know who you're talking about.
In November, after the election, we had another group meeting, and it was held at MSU Billings in an auditorium, and just again a kind of a public forum. We're going forward with this legislation, and Kim from MSUB just really helped begin to coalesce that group. By golly, folks, you need to get working. You need help with distribution and contact and getting the word out. And that's where Pluck stepped in and offered to provide distribution of this information on your website. So as people just began to step up, you could just begin to see it developing into momentum. Okay, so now back to, we come out of House appropriations. And the bill is now going to be heard on the floor of the House. And Kendall Van Dyke gives his overview and his presentation. There are some questions that he's asked by his colleagues that he can't answer, and there's others that stand up. But what was unbelievable, Representative John Sanju offered an amendment to strike the amendment, the sunset amendment that was added in House appropriations, and he gave a passionate speech about why to put a 2-year sunset on this. That it was cutting it off at the knees before he even had a chance to survive, and it seemed to him a ploy to basically another way to strategy to kill the bill. And he talked out of his heart as to why this needs to go forward. And it carried the day. And they took that amendment out. So they amended the amendment out And what that did was it returned the bill to its original state in which it came from the Senate. The only amendments that were now on the bill were amendments that were approved in the Senate side. And that ensured that the bill passed. It was interesting at each stage. One last comment: the bill, it was like a tide, and it started out with just this small group of parents and advocates and educators, specialists, therapists, and it just began to take on a life of its own. It was remarkable to watch that. By the time it got to the House, I mean, we knew it was going to pass. What we didn't know is in what kind of form it would pass. We knew it passed the House, but we didn't want it to have to go back to the Senate. We certainly didn't want to see it have a mere 2-year sunset, which basically would have strangled it before it really had any life to it in terms of affecting people's lives. So the bill was signed by the President of the Senate, sent over, signed by the Speaker of the House, was sent to the Governor, and I think people know the rest of the story. The Governor had a remarkable event here in Billings, bill signing ceremony with advocates and people of all parties celebrating in that victory. The bill becomes law January 1, 2010, as I mentioned before, and it does one of the other amendments that was added in the Senate side. So it becomes effective whenever a plan renews after January 1st. As I've been told by people at Blue Cross Blue Shield, who told me that probably the majority of plans renew in January. So most plans, the rest renew probably in July. So there may be plans that may not start January 2nd. Their insurance group plan will start maybe in July. Some, very few, as late as September. So we'll just see how it's implemented, what the coverage, what the track record is of the coverage. And but it was a remarkable story of human grit and determination to overcoming tremendous odds, and it was driven by a lot of really driven by the challenges that these families experience every day, try to make their life better and give their child a chance to have as normal a life as possible. What other questions do you have?
Oh, I got lots.
Oh, okay, all right, here we go.
Well, first, I just look back, a year ago, what services were there for families, and the tremendous change that's happened in the last year.
Well, when you think of now the autism waiver is now implemented, technically started in January with 12 children being selected in a lottery, but that we will have, and with the additional increase, the modest increase that came in the governor's budget to that original, we'll have close to 50, probably by July or August. In that, and they will have those children, will have up to 3 years of intervention up to age 8 through that Medicaid service. But yeah, when you mention that, what that begins to do, it becomes kind of a tipping point for specialists, because frankly we both know there's been little incentive for people with skills to come into the state to set up a practice to focus on work with children with autism, because there really has been very little in the way of payment mechanisms. Unless a parent was able to dig into their own holdings or mortgage their house, a lot of the therapies they just didn't have.
And now there's a program up here at the university and the speech program at U of M.
That's right. It's a speech pathology, I guess I call it speech pathology program at University of Montana, Missoula. But MSU Billings, Dr. Cheryl Young has started that undergraduate curriculum. Isn't that right? And that is beginning this next year, or is in process now.
Somewhere.
But that actually provides a track in the university system undergraduate track for specialization in autism. Now, that's pretty remarkable. I mean, all exactly as you say, in one small year.
Yeah, tremendous change.
When I think of how the autism waiver actually came to happen, that the state made a commitment, the administration made a commitment to initiate that prior to the next legislative session with residual funds that were there as a match to get it started. I don't think it would have probably have happened given the economic climate if it had not already been launched prior to the session. You know, as of last, when I went to the legislative legislative finance committee meeting last September, the projections were significant for ending fund balance and surplus. By October, and then even worse in November, it went the other way, and it kept dropping every few weeks during the session. So I just don't think there's any way we could have gotten a whole new Medicaid home and community-based program established without that initiation.
It's amazing. So what, tell us your secret about what do you do, what did you do behind the scenes when all of this was happening?
A lot of it is talking with other advocates and lobbyists, making sure that they're aware of this, talking with legislators on a one-to-one basis to help them to answer their questions. Because, yeah, I think you have a good point. It's often not just what happens in the testimony. They have all kinds of questions and challenges that they're struggling with in the interim. So it's just in the halls. A lot of time was involved in discussing and negotiating with the insurance industry. That's where the compromise came, we felt, of the dropping to $20,000 as an annual limit after age 8. Also, there was a change. You know, a couple other changes came really at their behest. And I think a lot of time it's spending listening to people as to what their real concern is, not just maybe what they're verbalizing. A lot of it has to do with costs. And as I indicated, there was a lot of time that was involved in discussions with the administration about trying to find a way around the fiscal impact. In fact, I mean, that could have been a deal breaker, especially in this environment. There was really no surplus. It certainly put the governor's office in a difficult predicament if it was going to have a significantly high fiscal impact. Hence, that was part of the rationale for dropping the annual amount. So there's a lot of that kind of give and take that goes on. I have to say the insurance commissioner's office provided a lot of, I mean, just basic information and assistance and help in understanding some of the complexities. I have to tell you, I am very unfamiliar with insurance statutes and the complexities of that. My background is more working in the appropriations process. And I certainly don't pretend to understand the complexities of insurance legislation, insurance law. So a lot of time, I had to take a lot of time trying to understand what all these cross references meant to be able to answer other people's questions.
So, as a result of this, do we know how many families this will impact and what percentage that is?
I don't have the statistic. There's been so many statistics floating around. I'd have to look at my notes, but it is interesting. One of the benefits that came from that autism work group and the funds that were released and identified to help start the waiver and to launch that, there were funds that were committed to help pay for assessments and evaluations. And you probably are aware, I mean, you remember that this was a big decision. As of July 1st of last year through March of this year, the state would pay for an assessment and an evaluation of any child. I believe it was under the age of 8 or under the age of 5. No, in fact, it was not limited. It was not limited at all. To get a diagnosis, the State Department of Public Health and Human Services was interested in seeing a baseline. You know, how many children out there can we truly diagnose? And there's a pretty rigorous process of diagnosing a child with autism or autism spectrum. There's a lot of times, in fact, I've been told, a physician may think it's one thing and it turns out it's autism. Or they may think it's autism, but it's not. And that's why you need to send a child to, and there were 3 clinics that the state contracts around that cover the entire state of Montana, and they will do these various rigorous assessments and evaluations to determine a diagnosis. And so the last I heard, as of the end of March, there were something like 170 kids. There were 170 kids tested, and I believe it was like 112 were identified with autism. So that's out of those that were suspected. That's still a pretty high percentage that came out with a diagnosis of being of autism spectrum, somewhere on the autism spectrum. There are other conditions that may look like autism, but you know, through whatever the different protocols that are used to try to determine. So, you know, I don't think we really know how many are out there. As I said at the outset, the state finds kids that were never diagnosed and they come back as adults, and they've been diagnosed with autism, and they have other developmental delays. So I think we will have a much better handle on that in the next few years. The state is also bringing out the director of the Autism Bureau in Pennsylvania. I think Pennsylvania is the only state that has a distinct bureau for autism. She and her child, who's on the spectrum, he's 17, they've been coming out for years to dig dinosaur bones in the summer in Montana, and she said she would love to come to Montana and to discuss the kinds of services and also the systems that they have to try to capture. I think between the University of Montana and the content that is being developed there, I think the skills that are being refined in the 3 clinics, and as well as Montana State University and their systems, will have a better sense probably 5 years from now of what we really are looking at.
Well, you sort of answered my next question.
Yeah.
Yeah,
meaning I don't know.
No, well, right. But it's like just kind of getting a handle on, you know, who haven't we, you know, covered yet? You know, what's still left out there? You know, families that are dealing with this still on their own because they're not getting, you know, waiver services. They don't have insurance. You know, who is left, and you know, what can we do, and you know, and sort of what are the next steps?
I think what will be important, and sometimes it's baby steps. The insurance industry, I think, made a pretty good argument. They said, well, why are you limiting this only to children who have group health insurance? And they even threw out other options of ways of serving. Maybe there are better ways that we can serve. But I think until we get at least 4 or 5 years under our belt, and if we can begin to quantify the effects of early intervention in Montana, then I think that will begin to build momentum. Well, the other kind of unknown here, the Obama administration, going back to their campaign for the presidency, had a position paper and a draft bill, a model bill, to mandate coverage of autism nationwide. And that is still out there. It's also going to factor into, as we both know, this whole discussion and debate about the nature of health coverage in the United States. What kind of a health delivery system and payment mechanism should we legitimately have? Because there's so many millions of people, not just for coverage of autism, there's so many millions of people that have virtually none or no insurance coverage at all. And the result is people stay out longer and become sicker for whatever their condition may be, and they end up in a hospital. Those costs are passed on. The hospital has to serve them in the emergency room, and then those costs are passed on to everybody else through the whole system. So woefully inadequate, and it is. I think we're going to have the debate now, ironically, in this economic crisis that we should have truly had, 15 or 17 years ago.
Do you have any thoughts, final words that you'd like to give to the public?
Well, I just will say that it's hard to, I'm fairly, I've been around the block or two with the process of legislation and of trying to work with these kinds of issues from a public policy standpoint. But this one has certainly gripped my heart. I know Senator Yellen said that it pulled at her in such a human way. And, being a parent, I've got, 5 kids and 5 grandchildren. And it's, you see all the kinds of changes and challenges that parenting brings, and it touches at your heart in ways that that are almost unimaginable. But I feel that I've made established friendships that I know I'll have the rest of my life just through this one legislative process. It's been a miracle, I guess we might say, that it passed, but miracles often take a lot of work. A lot of hard work. It's not just marching up to Helena and making things happen. There's a lot of people pulling together, working together.
That's the miracle.
It is, yeah, that's right. Oh yeah, cooperation. It's a lot about building community too, and finding compromise, which I think is the hallmark of our American democratic system anyway.
So when it works
well. Yeah.
Okay.
Been a pleasure.
Perfect. Thank you, sir.